My name is Theresa Webster. I'm a psychiatric nurse practitioner. I work with a multitude of mental health issues, trauma being my passion. I feel that a lot of issues in mental health stem from trauma. Not always, but oftentimes. And there are a lot of times that patients come to me and don't even recognize and realize what trauma is for them. I think trauma became a passion of mine, having had my own experiences with trauma of various kinds. And so I think that I can hear people on a different level than perhaps someone who hasn't experienced some things themselves. It leads to depression, anxiety. It can look like ADHD. A lot of substance use stems from trauma. Substance use is another big passion of mine. I feel that it's misunderstood, and when you can work with people with substance use disorder and make them feel human and make them feel seen and heard, then you can really get to the core of the issue and start healing. I think that I have a unique way of working with people that is a little more casual than your traditional provider. Sometimes you have to joke a little. Sometimes people tell stories that they might not think is relevant. They think they're just going to talk about medications, but I want to know about their life. I want to know about their children and their jobs and what they did that day. And I want to get to know them as a whole person. A philosophy of mine in my treatment of people is that I need to remain humble, and I need to know that there's a human being on each side of the desk. And there's no hierarchy, and it needs to be a safe space for both people. I work with students, and that's the core value I want to teach them. And when a patient ends their first session with me or starts their second session with me and tells me, "I never felt so seen and heard before," it's the biggest compliment. And I oftentimes have to sit in silence with myself at the end of the visit and reflect on that, because that ultimately I want to help with their symptoms. I want to help them feel better. I want to help them feel content and happy in life. But it starts with making them feel seen and heard. And when I get that compliment, that's all there is.